My name is Blair Fink, and I've been living with Crohn's for about 40 years now. I've had 3 bowel resection surgeries, the latest being in January of this year, and I've had a total of about 3 feet removed now of bowel. I think that when you're in your 20s and you're diagnosed with a chronic disease, you think, maybe if I don't think about it, it'll go away. And but that wasn't the case. You learn that pretty quickly. As I think back now, I think, oh yeah, I probably didn't do this. I probably didn't get as involved in maybe some sports and maybe travel. I probably would have liked to have traveled more, and I found that difficult as well. And even career choices, I probably found myself limiting myself to what I knew rather than taking on a new challenge because would my Crohn's be worse? I am happy that Blair was diagnosed early and that he has a much better range of treatments. I think he had had symptoms for a month or so, and the symptoms certainly felt to me like they might be Crohn's disease. But as a parent, you feel that you want the best for your children, and Crohn's disease diagnosis is certainly not on the best list. So I guess I felt some sadness and some anger as well. Sadness that I knew what he would be facing, and also anger, I guess, that this disease was now controlling another part of my life as well as his life.
Hi, I'm Blair Fink. I'm 27 years old. I was diagnosed with IBD in September 2012. Having IBD means having just a disease that I know that I'm going to have for the rest of my life, probably, and something that I'm going to have to maintain and live with. I was concerned about surgery. I knew that it was a possibility. My mother, who has Crohn's disease, has had 3 surgeries, but I knew that there was still a lot more steps to take, like with the first drug and then the steroid, and then there was still options that I had to go through. I feel like I have a good support system in terms of my mom and the knowledge that I have from that and from my specialist and the GI clinic in general.
I'm Alexandra Frolkis. I'm an MD PhD student here at the University of Calgary, and I'm supervised by Dr. Gil Kaplan. It's estimated that about 25,000 people in Alberta have Crohn's disease or ulcerative colitis. And we know based on the meta-analysis what the estimated risk of surgery is in people with Crohn's disease or ulcerative colitis. So we can expect that about half of those people with Crohn's disease will have a first surgery within 10 years, and about 15% of the people with ulcerative colitis will have a first surgery within 10 years of their diagnosis. For this publication, we looked at the risk of surgery in IBD. And we looked at 30 population-based studies that looked at surgery risk, and we identified that the risk of surgery is decreasing with time. So essentially, people who were diagnosed 50 years ago had a completely different disease course than people who are diagnosed today. So even though the incidence and prevalence of IBD are increasing, so we're seeing more cases of IBD, fewer of those cases are resulting in surgery. Also, what we were able to do is report decade-specific estimates. So based on the decade that someone is diagnosed, we can tell them what their surgery risk is. So for example, we can say if somebody's diagnosed in 2007, your 5-year risk of surgery is 24%. If you had been diagnosed 30 years ago, that risk would have been more like 32%. So you're seeing an 8% decrease in risk of surgery over time. It essentially means that something is being done right. So we're seeing more cases of IBD, but we're seeing fewer occurrences of surgery. So that likely means that a combination of medical advancements, so treatment options, better practice patterns, better care, better patient awareness, and seeking early intervention, that's all likely contributing to a better disease outcome.
I guess my ultimate hope would be that there would be a cure for Crohn's disease in my lifetime, and if not for me, hopefully in Blair's lifetime. The future is bright, I think, and I certainly don't feel as alone with the disease now as I did 38 years ago.